Hello, everybody. This is Dr. Kevin Connors tackling some of the biggest questions that we receive. This question is always a very serious one. What if it's metastasized? What if my cancer isn't just stage 1 anymore? What if they told me it's stage 4? What if I'm already in hospice? What if my mom is laying on a hospital bed in the middle of the living room? Is there still hope? That's a great question. So the question really is, can I still get care? So the answer is yes. So understand from a natural perspective, we're treating the patient. We're not treating cancer. So even if the cancer has metastasized, our protocol, yes, it's going to look a little bit different than if you're in stage 1. We may be a little more aggressive, but the right frequencies will still work. They're going to go across your whole body. So it's not just specific to that one location. So if you have breast cancer that's metastasized to the liver and the lungs, it's still breast cancer in the liver and the lungs. It's not liver cancer and lung cancer. It's still those breast cancer cells that have metastasized through circulating tumor cells to a different part of the body. So when we use right frequencies or we use nutrition and we're using diet, it's still going to affect that cancer anywhere in the body. So you don't need to worry. What we're going to be doing is going to be hitting that cancer and stimulating your immune system so your body will help attack that cancer no matter where it is. So yes, you can still get care, and yes, it still does work. Just a side note, the majority of people that come to us are stage 4. And again, we're not oncologists, we're not treating cancer, we're treating the patient. I wish more people found out they had cancer and then they decide to do an alternative protocol, maybe along with conventional medicine as well, but most people don't. And I know some people just got diagnosed with cancer and it's already in a later stage and they're searching for help. We want to help people wherever they are. We also tell people don't ever give up hope. We've had patients stage 4 cancer that were given 2 weeks to live years longer. Everything we do isn't magic. We're trusting God in all our decision-making process. Literally, we're praying over our cheek swabs and testing before we do any of it. So you can always still get care. You always still have hope. Does alternative care still work in later stages? Yes, it can. So when you strengthen the body and you strengthen your cells, it's always going to be better than if you are just doing standards of care or you're just trying to manage. The things that got you to where you're at right now, we have to make some changes. We need to support your body to build it back up, to be able to heal your body. And certainly I would never try treating cancer without the use of a Rife machine. What's your success rate? That's a common question we get. Unfortunately, it's not a question we can answer. There's legal guidelines that we have to follow. We're not treating cancer. We're not keeping success rates. And I know everybody wants to know, I don't want to do anything unless there's, what's the chance of this working? The only honest answer to that is, I don't know. We are in God's hands. I believe my days were numbered before the foundations of the earth were set. It's my responsibility to do everything I possibly can, but I don't know what is going to work and what's not going to work. We just have to do everything we possibly can. Bottom line is there's still hope. That's really what everybody are looking for. There is a lot of hope. Do not believe if somebody told you a timeline, you just have to get that out of your head. You just got to just erase that. Ask for God to erase that from your mind. There's always hope. He's sovereign over all things, and he knows what's going on, and we need to just follow him. And that's really what we ask our patients to do. Pray about whether this is the right thing for you. Know that we're going to be praying for you no matter what decision you make, even if you don't come here. There's always hope. We just got to put our hope in the right place.